Again, I welcome you all and hope this session will be kind of introduction and kind of informative for all the participants about the uses of dry needling and why we are using it. Being a physiotherapist, what's the need of using this dry needling? Because most of the time it's not a part of physiotherapy, but still nowadays we are using it a lot. So coming to the first thing is disclaimer, as this dry needling is an invasive process which doesn't give you any license to practice with just the online courses or some online materials. It doesn't give you the license. So for in order to practice dry needling, you should be having a strong hands-on technique experience. Okay, you should get the certification so that you can easily practice this technique. Okay, so this webinar is only for the guidance and information regarding the effects of dry needling and also provide just theoretical knowledge as introductory to the participants attending this webinar or conference, you can say. This webinar doesn't provide any certificate or license to practice dry needling in clinical practice. If any of the participants are practicing dry needling, it's their sole responsibility to handle the legal matter, as neither the instructor nor the organizer is responsible for it. So it's clearly I am telling that this online presentation is just for the information so that you can see that why we are using it, what is its effect, how does it act, and why it is beneficial for our physios. Because many a times what it happens, like whenever we talk about dry needling, it mainly says that sometimes people say that why a physio should use it. Sometimes many a times people say that physio are not allowed to practice dry needling. Okay. Sometimes it's like many of your client or many of your senior or many of your junior, they can say that why you need this dry needling, because we have got lots of other modalities being a physio. Yes, it's true that we have got other physical modalities to treat, but nothing is bad in learning any technique if we get better result with that technique. Okay? So seeing the results, based on the results, we are practicing it, and it's nothing like that. Most of the time it says that physiotherapist cannot practice dry needling, but no, it's not true. Basically, whenever you talk about the dry needling, you can see that on what basis we are using in India. Mostly we are following the APTA guideline, which says that a physiotherapist can perform dry needling in clinical practice for member and its components. There are so many associations in India or abroad, not in India. So as such, there is no guideline, any such defined guideline in India, but still in India we are following the APTA guideline. But there are so many other, you can say other federation, they says that a physiotherapist can practice guideline. Okay, practice dry needling. So according to the Federation of State Board of Physical Therapy, okay, they say that physiotherapist can perform and practice dry needling in clinical treatment process. Okay, then again, according to the Irish Society of Chartered Physiotherapists, even they say that a physiotherapist can practice dry needling. Only thing is that all these federations, they say only a physiotherapist can practice dry needling only if they are certified enough to practice. Okay, so now coming to the what is dry needling. So we are following the APTA guideline, like I said. Okay, so in the APTA given our definition in 2016 in Fab, that dry needling is an invasive process in which we use a thin filamentous needle. That needle is acupuncture needle only, but that is drugless again. So we use a thin filamentous needle to penetrate the skin and stimulate the underlying myofascial trigger point, musculoskeletal and connective tissue for the management of neuromusculoskeletal pain and movement impairment by breaking the pain gate cycle. So obviously this dry needling, it works on the pain gate cycle and healing theory. It is an evidence-based treatment, okay, which requires an effective manual assessment of the neuromuscular system. So if you are not you can say the sound enough in your neuromuscular assessment process, if you are not sound enough in your anatomy part, you won't be able to do the dry needling effectively. Okay. The second part is coming to what is difference between, like sometimes many times people say that is it acupuncture, but no, it's a big no. There is a lot of difference between the dry needling and the acupuncture. Only similarities between both is that it has got the same equipment, that is the same needle which we are using in the acupuncture, we are using same needle in the dry needle. Rest other thing, the theory, the mechanism, rest everything is different. The acupuncture, it works on the traditional Chinese medicine theory, of which it says that the traditional Chinese medicine theory says that it works on the energy flow. It works on Qi energy flow. But dry needling, it totally works on the anatomically and physiologically. It doesn't have, like acupuncture, it has got the hypothetical theory, but dry needling, it is a proved theory. It works like how it works physiologically. We can like justify that. Okay? So it is totally based on the modern science. Okay? Now, whenever we talk about the dry needling, sometimes we say that it's like trigger point dry needling. We call the trigger point dry needling. Okay, so whenever we talk about dry needling, we talk about the trigger point. What is that trigger point? Because we insert the needle, that filamentous needle, over the trigger point. Okay, so coming to the trigger point, what is that? Basically, just I want to give an example. Like, see, before going for the like parts of like a dry needling, like how does it affects, or how does it gives the effects on the trigger point of pain? Just I want to just give an example. See, if someone has got like trapezitis, like I said, okay, neck pain or trapezitis, inflammation of trapezius, okay, and if anyone is a good manual therapist, minimum it will take like 15 or like 10 minutes, 5 to 10 minutes in order to release manually. And lots of energy we need, and lots of pressure we have to apply with the thumb. So suppose in one day we have got 15% of the trapezitis, or like you can say that calf tenderness. And if we want to release it manually, by end of the day, we will need ultrasound in our thumb, because it needs lots of energy in order to do that, in order to release manually, in order to release the muscles or the trigger point manually. But if you want to release that muscles or release those trigger points with the dry needling, you can easily treat 50%, 100%, and you will not feel low in energy in your body. That's the difference. It saves our energy, it saves our time, and it gives the deeper and the quicker result. And even the results are long lasting. So why not we should use that? So coming to the what is trigger point? A trigger point is a taut band of skeletal muscles located within the larger muscles group. It is hyperatable. You can see in the diagram. Okay, so you can see here the taut band and this nodule, that is the trigger point. It is hyper irritable. Okay, if you try to press it, patient will give a jump sign. Okay, that means ouch sign. You see that it is a jump sign. Usually in our body, like more than like 620 potential trigger points are present, and those trigger points are present in the latent phase. That means latent phase means those trigger point doesn't gives any clinical symptoms. Whenever those latent trigger points get activated because of any injury, because of repetitive strain, or because of overuse, those trigger points, it becomes active, and then it starts giving the pain or symptoms in our body. So basically we have got two types. Okay, one is active trigger point, and second one is the latent trigger point. Active trigger points are those trigger points which refers pain either locally or to the another location along. Okay, but it doesn't. The trigger point doesn't refer the pain in the nerve pathway. So you can easily differentiate the pain referred by the nerve or the pain the pain radiating by the nerve or pain referred by the trigger point. So you can easily differentiate that. The latent trigger points are the one of that exists but doesn't refer pain actively, but may do so when you apply the pressure to the musculoskeletal structure. So if you're trying to palpate the latent trigger point, if you palpate it, give pressure to that point, it will start giving the pain. Otherwise, it doesn't give any pain or symptoms in the body. So you can see in the diagram, okay, in the image, okay, like the X mark is the reference location of the trigger point of the supraspinatus muscle. So each and every trigger point, they give the pain in a specific pain referral pattern. They give the pain in the specific pain referral pattern. So based on that pain referral pattern, you will be able to justify, you will be able to find out like which muscles are involved and which muscles we have to treat. Based on the pain referral pattern, you will see that. Now coming to the how does this dry needling works. Okay. So whenever we insert the needle over the myofascial trigger point, what it happens, like we insert the needle, that filamentous needle we try to insert over the myofascial trigger point. So whenever we insert the needle over the trigger point, what it happens, like we trying to create the micro trauma over there. So when we create the micro trauma, what it happens, it causes the local bleeding, and those bleeding promotes healing by delivering numerous growth factors. This fresh bleeding, what it does, it promotes the healing by delivering the numerous growth factor, which including the platelet-derived growth factor. And it is the function of platelet-derived growth factor. It attracts the cells, induces the DNA synthesis, and it stimulates collagen and the protein formation. And that is how the healing process starts or accelerates. And as we all know, that as there is an increase in the blood supply anywhere, there will be decrease in the pain around that area. So obviously, if there will be increase in the fresh blood circulation, there will be decrease in the pain. So this is the mechanism on which this dry needling works. I have already discussed about the pain referral pattern. Okay. So what is that pain referral? Because see, few things it really matters, like trigger point and pain referral pattern, in order to find out, in order to do assessment for the proper treatment through the dry needling technique. Okay, so you should know the pain referral pattern. Each and every trigger point of the muscles have got a specific pain referral pattern. Okay. So what is that pain referral pattern? It is the pain perceived at the location other than the site of injury or lesion. So what does it mean? Like whenever we talk about the pain referral pattern, it doesn't mean that every time the pain will be localized around the trigger point. Many a times it gives the pain at the other location other than the site of injury or the lesion. The reason of this referral pain is because of the network of interconnecting sensory nerves that supplies many different tissues. It is the pain referral pattern is because of the result of the interconnecting of the sensory nerves that supplies the many different tissues, that is myotomes and dermatomes. See, myotomes and dermatomes. Usually all myofascial trigger points gives pain in a specific pain referral pattern, okay, to the specific area of the body. So you can see that again, the upper trapezius, this is the pain referral pattern for the upper trapezius muscle. So whenever any person have got the active trigger point in the upper trapezius, that person will get pain, experience the pain in the occipital and temporal area, then like you can say side of the neck, okay, and even sometimes at the jaw, mandible area, angle of the mandible, okay. So now coming to the indications, almost like it is indicated in most of the musculoskeletal pain, even like dry needling has got very good result. Nowadays, we are using dry needling with the electrical stimulation in neurological cases, as also like foot drop, dish drop, facial palsies, we are using muscle stimulation with the dry needling. Okay. Then headache, frozen shoulder, again tennis elbow, carpal tunnel. It is one of the best technique I have seen till now, according to my experience for the plantar fasciitis. With just one or two needles, within just one session, you can get 50 to 60% pain relief in the plantar fasciitis cases. So I personally feel it is one of the best technique for the plantar fasciitis. Then golfer's elbow, hip pain, leg pain, hamstring strain, sciatica, plantar fasciitis, cervical pain, osteoarthritis of knee, and shin splint. All these are the musculoskeletal problems. Even in case of neurological neurological problems, like I said, we are using for the facial palsies or Bell's palsies, then we are using for the foot drop and disc drop as well. Okay? Now coming to the contraindications. So whenever we talk about the contraindications, there are two types of contraindication. One is absolute contraindication, and second one is the relative contraindications for the dry needling. Absolute contraindications means like strictly no. So if before going for the dry needling technique, okay, we always ask the patient to sign a consent. If the patient is not ready to sign the consent, we don't do dry needling to that patient. Then if there is any infection, like existing infection at the site of the dry needling, we are not going to do dry needling over there. Then patient phobia of the needle, patient unable to remain still or follow the instruction. The fifth point applied for every technique, that therapist lack of knowledge about the technique. Then the sixth point is allergic to the surgical steel. Okay, so if any patient who is allergic to the surgical steel, we are not going to needle them because that needle is made up of surgical steels. Okay. Then acute cardiac arrhythmias, cancer, diabetes. These are the some of the absolute contraindications. Okay. Then relative contraindications is comes like hemophilic patients. Then if the patient is on warfarin or like anticoagulant drugs. Okay. Then in case of pregnancy in first and last trimester, we usually say not to needle because lots of hormonal changes is going on in first and last trimester. Okay. But in like second trimester, you can do that. Okay. Before performing the dry needle, we have to follow certain clean fill techniques like proper sterilization of the equipments and the area. So we have to follow that. Okay. So whenever you want to do dry needling, use the surgical gloves. Okay. The room or the area should be like ventilated or proper lighting should be there. The area should be clean enough. There should be proper sterilization methods should be followed. Like we have to use the surgical gloves. Then the bed where we are using, where we are asking the patient to lie down, that should be clean enough. There should be no dirt or dust over there because it might create the infection to the patient. Okay. So these things we have to see before going for the dry needling technique. Then coming to the sterilization needle and equipment. So we use the single the single pre-sterilized disposable needle. So we don't recommend to use the same needle on the same patient again. Okay. Then disinfectant must be used wherever you want to do the needling. Try to clean the area either with the alcoholic sprit or alcohol swab or anything. Okay. So you can clean the area, then try to use that. Okay. Then after that, once you have needled it, like we have got certain time, like we can keep the needle for 3 to 5 minutes. Okay. And on the alternate day, you can treat the same muscle. So if we are needling today any muscles, we are not going to needle it tomorrow. We can needle those muscles again day after tomorrow. The reason is why, because what it happens, like whenever we needle anywhere we needle it, usually there will be soreness will get developed. So in order to decrease that soreness, we are asking you to needle on the alternatives. After that, coming to the disposable of the needle. So in order to dispose, we are not disposing the needles in the dustbin. Okay. So because this comes in the biohazard things, biomedical waste. So what we do, we collect the needles and we try to dispose it off in the biomedical waste area. Okay. So don't dispose the needles in the dustbin. After that, coming to the types of dry needling. So basically we have got two types of dry needling: superficial dry needling and deep dry needling. Superficial dry needling is for the superficial, like you can say fascia or superficial muscles. Okay. Then sorry for the inconvenience because of some technical issue. I think it was. Okay, so I was just talking about the types of dry needling. Okay, so you can see over here we have got two types of dry needling. One is like superficial dry needling, and second one is the deep dry needling. So superficial deep dry needling is mainly for the fascia release or facial pain, or you can say that superficial muscles. Okay, after that we have got the deep dry needling. Okay, so deep dry needling is mainly for the deeper muscles, like you can say that example for like the gluteus muscles, like gluteus minimus. Then we have got the multifidus muscles, so all these muscles, yeah. We do the deeper dry needling. Okay, so for deep dry needling basically we use the larger needle, and for the superficial we use the smaller needle. uh, we use different size of the needle. Basically the diameter of the needles remains same, and it varies little bit, like 0.25 mm is the diameter basical usually. But if we are talking about the larger needle, it's like 0.30 again, and the sizes varies according to the area we can use. So like 13 mm, then 25 mm, 13 mm, 40 mm, 50 mm, 60 mm, 75 mm, and 100 mm. So depending on the muscles bulk, okay, and depending on the area. The most important thing in treating with the dry needling is like we should have the sound, like I was telling in the beginning only, we should have the sound knowledge of the anatomy. Okay, because we try to insert the needle by looking, by considering the deeper structure as well. So we should not insert the needle over the nerve, or like blood vessels, or like some, we should avoid touching the needle, we should avoid touching the visceral organs with the needle. So we have to take care of that thing. So whenever you want to insert the needle, we have to always consider the visceral structure as well, because if we are inserting the needle on the trigger, like instead of trigger point, like we are inserting the needle over the nerves, it might give a sharp shooting pain to the patient, and sometimes the neuropraxia might happen. Okay, then after that there are like a few things we should always keep in mind before treating the dry needling. The first thing is, like most important thing is, okay, like the musculoskeletal examination assessment should be proper. Once you have done the proper assessment of the musculoskeletal system, then only you can identify which muscles are associated and which muscles you have to treat, which trigger point you have to treat. Okay, so dry needling is not rocket science. It's nothing like that. You can easily use it. You can get the best result through the dry needling in order to release the pain, musculoskeletal pain. But still it requires lots of like hands-on practice. Okay, so in order to like use this dry needling, you can either you can attend any of the workshop, certificate course, or okay, organized. There are so many good resource person. Okay, so it's nothing like that, because many a times people say that international workshops are only beneficial. So it's nothing like that. We people are sitting in India, so at least we should follow some of the things, okay, make in India type. Okay, so why not we should learn from Indian instructor if they are good enough to teach. Okay, so why we should go only for the international instructor? Okay, and why simply to pay a huge amount in order to learn those technique, if you can learn those technique in the less amount? So don't go for that stuff. Okay, that proper agenda of the people. There are some people, they usually think that okay, if I'm organizing international, I can earn more money. Okay, why not we should go abroad and we should earn their money? Okay, why we should give our money to them? Even I am traveling to many countries now, okay, in order to take this workshop. So why should we call them and then give a huge amount? So it depends on your choice. Okay, so you can learn this technique, and this is one of the good technique for the musculoskeletal pain. Okay, and so if you guys have got any of the problems or any of the questions, you can ask me. Okay, you can drop in the comment. I can reply to you. You can follow me on my social media account. Okay, this is my personal WhatsApp number. Okay, and you can follow me on Facebook, Instagram, or Twitter, anywhere, and you can get it in touch with me. If you have got any doubt, you can just write in the chat box, okay, or comment section. I can clear those dots as well. Once again, I would like to thank Dr. R.K. Mudgil for taking this initiative, and all the team members, like all the team members of Harcon. Every year they usually organize this international conference. This year, because of this pandemic, okay, they are doing it online, and it's a good initiative. Thanks to them. So, any comment, any questions? No? Okay, so thank you so much, everyone. Thanks for watching me, and sorry for the disturbance in the between because of the technical issue. Okay, so once again, thanks to everyone, thanks to the organizer. I'm just ending this live now. Okay, thank you so much, everyone. If you have got any doubt, you can get in touch with me anytime through WhatsApp or through Facebook, anything. Okay, thank you so much.